I'm Dr. Sureka. As today is World Cancer Day, I want to share few things about it. Feb 4th is being celebrated as World Cancer Day. The main aim of this day is to give awareness about cancer and have proper control and prevention and treatment about cancer. The theme for 2022 is Close the Care Gap. So there are many burdens or many risk factors which are not able to understand by the public. So there is a bias which is not able to go for treatment. People are unaware of what type of symptoms are leading or what type of symptoms are there for cancer. So we have few warning signals or warning signs of cancer. Any of these signals which are being said now are being observed, then it is time to meet a physician. The first signal is, or the first sign is, if you find a hard area or a lump in the breast for a longer time. The second thing is, if you find abnormal bleeding from any of the natural orifices, it may be from mouth, nose, okay. So any abnormal bleeding if you find from the natural orifices. And the third thing is, if you have irregular bowel movements, it means if your stools are not proper, if you have some irregularity in your bowel movements. Number 4, if you have a prolonged or a heavy bleeding in your monthly period or in your menstrual cycle, if you have prolonged or a excess of bleeding, then it is a warning signal. A change in a mole or in a wart, if there is any change in size or color, or you find any symptoms like pain, redness, anything, that is a warning signal. If you find persistent cough or hoarseness of voice continuously or for a longer time, if a swelling or soreness in any part of the body is not feeling better, or you have any unexplained loss of weight, there is sudden loss of weight, these are the major warning signals or warning signs to rush to a physician. These are signs for cancer. Every year WHO gives a theme related to the present situation. So this year World Cancer Day, the theme is Close the Care Gap. There is a deficient in realizing the problem. There is a deficient in understanding whether it is worried about the problem. This theme is to have a campaign about the persons or who are not aware of cancer treatment, who are not aware of the symptoms of cancer, making them for availability of treatment and how to be prevented and controlled. Easy detection of the cases. This is the main thing which has been considered about this theme. So major risk factors for this cancer, usually the major risk factors for non-communicable disease, that it may be diabetes, it may be hypertension, it may be stroke. So major risk factors for non-communicable diseases are tobacco, smoking, it is smoking, alcohol, then some dietary habits which are being altered, okay, and lack of physical exercise. These are the major risk factors associated with non-communicable diseases. When coming about cancer, we have two different factors associated. One is environmental factor and one is genetic factor. Genetic factor is something like already who are been suffering or who are been a part of the family who are suffering with cancer. There is a chance of getting of cancer in the other family members. That is one factor. The second factor is environmental factor. Environmental factor is maybe because of your habits, that is smoking, which may leads to lung cancer, mouth cancer, pharynx cancer, larynx cancer. Okay. When you come about alcohol, it may lead to liver cancer or esophageal cancer. Coming to dietary habits, many have a habit of eating the smoked fish or a smoked meat, which may leads to stomach cancer. If eating beef consumption or having a more beef consumption may lead to breast cancer. These are many different types of cancers which are being affected because of our dietary habits. How can we control? The major thing controlling is drinking alcohol, quitting smoking, having a proper physical exertion or physical exercise, and improving your dietary habits. These are the major things where you can control. Coming to the statistical report of these cancers, worldwide every year more than 1 crore 91 lakh cases are being registered. When coming to India especially, we have 4 major cancers which are being suffered. One is oral cancer, One is cervical cancer, breast cancer, and lung cancer. When coming to oral cancer, if you take about 1 lakh population, almost 5.4% death rate is being recorded every year. That in that 5.4%, 70% are males, 30% are females. Coming to cervical cancer, almost every year out of 1 lakh population, 18% of new cases are being registered under cervical cancer. So this can be prevented by personal hygiene. And coming to lung cancer, it is because of tobacco smoking or increased consumption of tobacco chewing or smoking. So this may lead to both lung cancer and also oral cancer. So here almost 8.6% of death rate is being recorded in 1 lakh population because of lung cancer, out of which 80% are from males and 20% is from females. The leading cancer in India is breast cancer. This is because of dietary habits, because of consumption of beef. So almost 9.8% of cases are being registered out of 1 lakh population, out of which many females are being suffering with breast cancer. So this is the high risk of cancers in India. So we have a government homeopathy cancer care center in Malappuram, which is specially on homeopathic basis. As I am a homeopathic physician, I want to promote this. We have cancer center in Kerala, which is helping many cancer patients both in palliative care and supporting them. We also have a national cancer eradication program which has been launched in 1975. So this program is launched to educate about cancers, different types of cancers, their symptoms, when you are supposed to rush to the hospital, educate the community about different types of cancers and giving information about the disease. This is the main aim of establishing this program, National Cancer Eradication Program. Thank you. A small request, many are viewing this video but not commenting or subscribing. I request you to please subscribe this video. If you like this video, please like, share, comment and subscribe. Thank you.